Hello and welcome to my channel Miliha, the online medical university. We are going to discuss about obstetrics and gynecology, and especially the first topic about the anatomy of the female reproductive system, and also we will discuss a little bit introduction to the male anatomy and male organs. Okay, so let's start. We will start here. This I have drawn a diagram for you. Here, introduction to the female reproductive system. You can also take a screenshot if you want. So here, this is the fundus, the base of the uterus. This is uterus. This is fallopian tube, and I am drawing like with my hand here. I hope that you can see this. And this is the ovary. This is the ovary, two ovaries on both sides. So the length of the fallopian tube, this is called the fallopian tube. The length of the fallopian tube is 10 centimeter. Okay, this is the fundus. The different parts of the fallopian tube, the first part, this is called inside, this is called interstitial part, because this is half inside the body of the uterus and a little bit in the wall. So this is in interstitial part. This is called isthmus, and this part is called ampulla. Mostly the fertilization takes place here, and the ectopic pregnancy also takes place here. The whole length of the fallopian tube is 10 centimeter. Okay, if I am talking too fast, you can pause it and listen to it again. Anyway, so this is the ovary. This is the isthmus of uterus. There are two isthmuses. I think if I am correct about pronouncing the plural, one, this is the isthmus of the uterus, and this is the isthmus of the fallopian tube. So this is the narrowest part of the uterus. Then this is the cervix. Okay, this part is called the cervix. The uterus has three layers: the endometrium, the internal layer, the myometrium, the middle layer, the perimetrium, the outer layer. This is the endometrium, myometrium, perimetrium, and this is the cervix. This corner between cervix and vagina, this is called fornix. This part is vagina. The finger-like projections of the uterus are called the fimbriae. Okay, so we have written here. You can take a screenshot of this. This is the fallopian tube, ampulla, infundibulum. This part is called infundibulum. Let's go further and discuss about the blood supply of the female genital tract. So here we will better check in the diagram. Okay, the fallopian tube is supplied by the ovarian artery. The ovarian artery is a branch of abdominal aorta. It's a branch of abdominal aorta. Okay, blood supply of the female genital tract, and this ovary is also supplied by the ovarian artery. The lateral 1/3 of the fallopian tube is supplied by the ovarian artery, and the medial 2/3 is supplied by the uterine artery. This is the uterine artery, and the uterine artery is a branch of internal iliac artery. Uterine artery, vaginal artery supplies to the vagina, and middle rectal artery also supplies to the vagina, and internal pudendal artery also supplies to the lower part of the vagina. So these arteries are branches of internal iliac artery. Once again, I will repeat: uterine artery, vaginal artery, middle rectal artery, internal pudendal artery. These arteries are branches of internal iliac artery, and this ovarian artery is a branch of abdominal aorta. So you can draw this diagram. This diagram I have drawn by myself. I am very bad in drawing, but excuse me and pardon me for my mistakes. Anyway, let's go further. You can also take a screenshot of this drawing, this diagram. let's go further and discuss the veins corresponds to the arteries. The veins are similar as the arteries, just we have named. Okay, from inferior, you should better take a notebook and you should write everything and draw diagrams, and by pausing the video, and in that way you can clear everything that you watch on this channel. Anyway, the nerves from the inferior hypogastric plexuses, okay, plexus, inferior hypogastric plexus supplies to the female reproductive organs. Here are again, we have in the text form. You can also take a screenshot of this. The uterus is supplied by the ovarian artery, the uterine artery, and the vaginal artery. Cervix is descending cervical artery, a branch of the uterine artery. And vagina descending cervical artery, middle rectal artery, internal pudendal artery. Just we had discussed, and we have also watched the video and diagram. Okay, fallopian tube here, medial two-third part is supplied by the uterine artery, and lateral one-third part is supplied by the ovarian artery. Okay, so ovary by ovarian artery. Uterine artery is a branch of internal iliac artery, and uterus supplied by ovarian, uterine, and vaginal artery. Again, this was a revision. Okay, let's go further and check. This diagram is about the lymphatic drainage. Okay, lymphatic system of the female reproductive system. Here, this is the aorta, this is external iliac artery, internal iliac artery on both sides. So the in front of the aorta, these limbs are called pre-aortic lymph nodes. I have written with a pencil which is not visible properly. Next time, hopefully, I'll draw a better diagram which will be visible and clearer. Okay, so this was my first video anyway. So I will not tell you to like and subscribe my channel. Anyway, let's go further, not wasting time here. Pre-aortic lymph node is this in front of the, and the lateral aortic lymph node. These supply to the upper part, the fundus and upper part of the uterus. This you can see as fundus of the uterus. These are the walls. This isthmus, this is cervix, and this is vagina. Okay, the lower part is vagina. So here, this the pre-aortic and lateral aortic lymph nodes supply to the upper part of the uterus, the fundus, and upper part. Here, the cornu is supplied by superficial inguinal lymph node. These lymph nodes are inguinal lymph nodes. Okay, the inguinal lymph nodes supply to the cornu and to the lower one-third of vagina. Okay, vagina or vagina, whatever is the pronunciation. Okay, this is the lateral external iliac artery supplies to the cervix. Internal iliac artery also supplies to the cervix, and the external iliac artery supplies to the upper one-third of the vagina. The vagina has been divided into three parts: upper, middle, and lower. The upper one-third is supplied by the external iliac lymph nodes. The middle one-third is supplied by the internal iliac lymph nodes, and the lower one-third is supplied by the superficial inguinal lymph nodes and the pre-rectal lymph nodes. This is written pre-rectal. Okay, the cervix is also supplied by obturator lymph nodes, which is, I have not mentioned here, obturator lymph nodes, and this sacral lymph nodes also supply to the cervix. These two, this I have drawn as a representation. This is not the exact diagram, this is just a representation of the anatomy. Okay, this lymph node we have discussed, it is written, you can take a screenshot here as well. Organs, lymph drainage, uterus, fundus, upper part of the body is drained by the pre-aortic lymph node, cornu, superficial inguinal lymph node, lower part, external iliac lymph node, obturator lymph nodes, external iliac lymph node, pre-sacral lymph nodes. Okay, vagina, upper one-third external iliac group, middle one third internal iliac group, lower part by prerectal lymph nodes, below hymen superficial inguinal lymph nodes. Okay, your uterine cornu is drained by superficial inguinal lymph nodes. Okay, this you should remember. And just I have shown you everything here. And these are the superficial inguinal lymph node, and this is the uterine cornu, or the horn of the uterus. So this we have discussed. You can take a screenshot here and proceed further. Here is a basic of male reproductive system. Some basic introduction. These are testicle. This is testicle, and this is the epididymis. The epididymis is a place to store the sperms, and where they mature is you can consider it as a school for the sperms. After maturation, they will go through this vessel. So this is called vas deferens. So vas, VASDEFERENS, vas deferens. So this is seminal vesicle. This is a kind of also storage, a bladder kind of thing. It is called seminal vesicle, where from there they go. This is the prostate gland is found in males. So this is the urethra. It ejects through this in during the ejaculation. So this is the male reproductive system, the basics. Here are some very important points which I have taken here. You can take a screenshot. Mullerian duct, there are ducts from which the male organs and the female organs are formed. Mostly the male organs are formed from the Mullerian duct, and the female organs are formed from the Wolffian duct, and both degrade in the opposite sex or gender. So Mullerian duct derivatives are uterus, fallopian tube, cervix, and upper 4/5 of vagina. Upper 4/5 part of vagina is derived from Mullerian duct, but not the lower 1/5 of the vagina. So the lower 1/5 of vagina arises from the endometrium of urogenital sinus. So to become more familiar with these terms, you must study embryology, histology, and embryology, where you can study the development of the fetus, and you will be more equipped with the knowledge and information what is Mullerian duct and what is Wolffian duct, and what is urogenital sinus and endoderm and all mesoderm, and all these things will be discussed in detail in embryology. Maybe I will make another video for you for that purpose, but right now we just should know that Mullerian duct derivatives are uterus, fallopian tube, cervix, upper 4/5 of vagina, and lower 1/5 of vagina arises from the endoderm of the urogenital sinus. Okay, the ovaries are formed mainly from genital ridge and partly from mesonephros. So ovary is not formed from Mullerian duct, or Mullerian duct is also called paramesonephric duct. Okay, so ovaries are not formed from this. They are formed from genital ridge and partly from mesonephros. Okay, para-ovarian cyst arises from the Wolffian duct. Para-ovarian cyst, the cyst around the ovaries is formed from Wolffian duct. Wolffian duct is actually this is a remnant of Wolffian duct. Wolffian duct forms the male genital organs in a male child, but in female they regress and remnants are left. They sometimes can form a cyst that is called para-ovarian cyst. Okay, Wolffian duct in the female forms epophoron and paraophoron. Epophoron and paraophoron, they are also remnants of the male duct, Wolffian duct. Wolf means a male, aggressive. Okay, by that way you can remember it, also called mesonephric duct. The Wolffian duct is also called mesonephric duct. Okay, so here again, excuse me, position of the Bartholin glands or duct is in the junction of anterior 2/3 and posterior 1/3 of in the groove between the labium minorum and hymen. So between the hymen, I have not discussed much about the external male and female genitalia here. You can search on Google. It's a very small section, and one image. By seeing one image, you can understand. And anyway, so the position of the Bartholin duct is between the in the groove of hymen and labium minorum. Okay, so pH of the vagina is 4.5. That you must an adult's vagina, pH of an adult's vagina is 4.5. That you should remember. Okay, they may ask you in any exam. So normal position of a uterus is antevirgin and anteflexion. What is antevirgin is, suppose this is the anterior, this is posterior. So antevirgin means like this, the uterus is in this position. In this position, if I am visible to you, the uterus is in this position. Ante means forward. Okay, antevirgin, forward, anterior, to front, and retroversion, if the uterus will be backwards like this, it will be called retroversion. So it's not normal. What is normal is this is called anteversion and anteflexion. Thank you, and we will go further discuss these points. Weight of a uterus is 50 to 80 gram. Okay, uh, then weight of a term uterus when the female is pregnant and she is about to deliver. At that time, the weight is 100 gram, 1000 grams, or 1 kg, 1 kilogram. Okay, weight of a term placenta is 500 grams, or half kg. Okay, half kilogram. Okay, narrowest part of the uterus is isthmus. This is, please remember, this is isthmus is the part of the, they are talking about the part of the uterus, not part of the fallopian tube. There is also an isthmus in the fallopian tube. So narrowest part of the uterus is isthmus, 6 millimeter. Isthmus forms lower uterine segment in labor. Length of fallopian tube is 10 centimeter, which I have already discussed. Lowest portion of the fallopian tube is interstitium. Okay, narrowest portion. Okay, widest portion of the fallopian tube is ampulla, and this is the longest portion. It might be, I will not say here widest, but it is the longest portion is the ampulla, and the pregnancy, ectopic pregnancy is happens in ampulla. Most common site for ectopic pregnancy. Ovary arises from the genital ridge, which I have already discussed. Ovarian artery is a branch of abdominal aorta, which I have discussed. Ratio of uterus to the cervix is in the children, the uterus is smaller than the cervix. So that's also awkward. Before puberty, uterus to cervix is 1:2, the ratio. At puberty is 2:1. At puberty, the uterus becomes larger than the cervix. At reproductive female, in a reproductive female, the ratio is 3:1. Best support to the uterus is cardinal ligament, McEnroe's ligament. Okay, cardinal ligament and McEnroe's ligament, they both are the same. That's the name of one ligament. You can call it cardinal ligament, or you can call it McEnroe's ligament. That's the best support of the uterus. Okay, we'll discuss a little bit more about the ligaments of the uterus. Round ligament does not support the uterus. Please keep in mind that the round ligament does not support the uterus. In this case, you can remember by saying round means 0. So the round 0 ligament does not support the uterus. Anyway, so let's go proceed further. Ligamentary support of the uterus, cardinal ligament, McEnroe's ligament, which we have discussed. Another ligament is uterosacral ligament, which connects the uterus to sacrum. Sacrum is the bone, okay, part of the backbone. Pubocervical ligament. Pubis is in front anterior side of a human body. So here I have drawn that ligaments of uterus, a uterosacral ligament. This you can consider as cervix or uterus. So this is rectum, this is bladder, urinary bladder. You can also keep in mind that the rectum is behind the uterus and the bladder is in front of the uterus. Okay, this is the pubic bone, this is sacral bone, this is sacrum, this is rectum, this is cervix, this is urinary bladder, this is pubis symphysis. Symphysis means that has the bones have attached here. Okay, now the ligaments. This is the uh, uterosacral ligament. Okay, this ligament is the cardinal ligament or McEnroe's ligament. McEnroe's ligament. This is the largest or the main ligament of the uh, uterus to support the uterus. This is pubosacral ligament. Pubosacral ligament. Okay, this is binds the uterus to the it should not be pubosacral, it should be pubocervical, yes, excuse me, it's written it's pubocervical. Okay, cervix to the pubis, sacrum is behind, uterosacral and pubocervical ligament. Okay, this is cardinal ligament. After that, we will discuss some little bit, only 10 questions about this multiple choice question. Blood supply to the uterus is from uh, uterine artery, ovarian artery, vaginal artery. Blood supply of the uterus is all of the above. Okay, paramesonephric duct forms the ureter, uterus, bladder, and penis. It's written as penis but pronounced as penis. Okay, so don't be shy because you are medical students and we have to discuss about these things. So anyway, concentrate and focus on the question. Paramesonephric duct forms paramesonephric duct is the Mullerian duct, forms uterus. Okay, don't be confused between the ureter and uterus. Okay, ureter is about urination and uterus is about female reproduction. So the answer is uterus. Next, question number 3. All are supports of the uterus except round ligament. I had told you the round ligament is 0, so it's not a support. Para ovarian cyst is derived from Wolffian duct. Okay, this is from the remnant of the male duct. In female, it forms a cyst. Okay, ovaries develop from which of the following? Ovary is developed from, you can say, endoderm of the urogenital sinus. We had already discussed with this, but in this case, you can say Mullerian duct will be the answer, but the better answer we had discussed here, the ovaries here, fundus, organs, lymphatic drainage, and duct derives. The ovaries are formed mainly from genital ridge and partly from mesonephros. So mainly from genital ridge and partly from mesonephros. Okay, let's skip this question. And next question is, narrowest part of the fallopian tube is interstitial portion, isthmus and infundibulum and ampulla. So this is the interstitial part is the narrowest part of fallopian tube. There they are not talking about the uterus. If they talk about uterus, then the narrowest part is the isthmus. Okay, next question is Bartholin's duct opens into just we had groove between labia minora and hymen. Okay, then here uterine cervix ratio up to 10 years of age is 2:1. Up to 10 years the uterus is smaller than cervix, so 1:2. D is the answer. So uterus is maintained in this position by uterosacral ligament, cardinal ligament, round ligament, and parametrium. Cardinal, mainly by the cardinal ligament. Uterus is maintained in this position by cardinal ligament. Okay, uterine artery is a branch of the internal iliac artery. A branch of internal iliac artery. Uterine artery is a branch of internal iliac artery. Okay, thank you very much for watching my video. This was my first video and we don't have light here, so I am using a lamp, and hopefully I will discuss the next topic in the next video, and I will continue teaching you on this my channel. This is called Miliha, the online medical university. Thanks a lot for your concentration. Good night and study and revise.